An important study for parents is out this hour in the Canadian Medical Association Journal. It found that children born in December, the youngest children in the class, are more likely to be overdiagnosed with ADHD or attention deficit hyperactivity disorder and therefore prescribed drugs for it. CBC medical specialist Dr. Karl Kabasele joins me live in Toronto. Dr. Karl, what did this study find when it comes to the connection between the so-called relative age of children and the diagnosis and treatment of ADHD? Take us through it.
Well, basically, this is a phenomenon that had been observed for some time, that depending on when a child is born, their likelihood of being diagnosed, rightly or wrongly, with ADHD changes. So in this study, because they were looking at the population of kids in British Columbia, where the cutoff is basically the new year, kids up until December 31st get to be registered in the current year of school, versus if you're born after January 1st, you have to wait till the following September. What they found basically was that both boys and girls who were the youngest in the class were more likely to be diagnosed with ADHD and also treated with medications for ADHD.
Okay, why?
Well, that's an interesting question. It's first of all, it's not clear exactly, what the cause of ADHD is. But the thinking here is that the younger kids, because they are potentially less mature, may be behaving, sort of more immaturely, more restlessly, if you will, and therefore more likely to be mischaracterized with ADHD. That's one possibility.
Okay. All right. One of the interesting parts of the study was that it found that girls born in December were 70% more likely to be diagnosed with ADHD compared with 30% of boys.
That's right, and that's just sort of a statistical anomaly in the sense that we know that boys are certainly more likely to be diagnosed with ADHD, and we also know that boys are more likely to actually have ADHD, but because the number of girls is so small, the small increase or increased difference just appears as a larger percentage for the girls.
I see. Okay. What are some of the signs that a child actually has ADHD?
Well, ADHD, because it stands for attention deficit and hyperactivity disorder, there's a spectrum. So some kids are going to have more of the attention deficit side of things, where they will have trouble paying attention. They may be easily distracted, or they may not seem to pay attention when you speak with them. On the other hand, there's the hyperactivity side, where kids are restless, they're fidgeting a lot, they seem to just be running high, their motor seems to be running kind of high. And but then again, for some kids, there's a combination of those two factors. So I think the bottom line really is that, just because your kid might be restless at times doesn't mean they have ADHD, that you really should rely on a professional to make the diagnosis.
But even there, is this study telling us that there is a real potential for over-prescription of the medications associated with ADHD?
Well, that is one of the dangers. So if in fact kids who are younger in their class are being overdiagnosed, they not only, become labeled as ADHD and therefore, all of the expectations that go along with that or perceptions, but also if they're overprescribed the medications, they're subject to all the side effects of the meds that obviously if they don't have ADHD, they shouldn't be put at risk of things like, sleep disorders and growth. It can stunt the growth of children. It can have cardiovascular effects. So we're trying to avoid unnecessary side effects.
I know there's another study out today that children who are faced with sleep disorders have problems with connecting with their peers and hostility as they grow older as well. So that, you're right, that opens up a whole new can of worms for children. But let's say a parent is suspicious about the diagnosis but doesn't want to contradict, the possibility is still there that the child has ADHD. Are there non-pharmaceutical ways of dealing with ADHD that a parent can turn to if they don't want to risk those side effects and complications?
Certainly. Aside from the medications, therapy can be very helpful. Special education, supporting kids in class and helping them to learn in their own way can also be very helpful. But I should say that usually a combination of medication and therapy and sort of behavioral intervention is the best approach. And for those who are truly diagnosed with ADHD, the medication can really work wonders in a child's ability to focus in school.
All right, CBC medical specialist Dr. Karl Kabasele, thank you once again for joining me in Toronto.
Thank you.
Okay.